Good morning, all of you. Today we are here with a special guest lecture. I welcome all of you on the behalf of Association of kriyasharir. I welcome all the dignitaries present over here. Today we are having a expert speaker, Dr. Kadambari S, Associate Professor in the Department of kriyasharir, KLE Shri BM Ayurved Mahavidyalaya, Shahapur, Belgavi. And for this session, the chairman of the session is respected Dr. Swati Chobe, madam. She is a professor and HOD in the Department of Kriyashari, College of Ayurveda and Research Center, Nigri. So I also welcome all the dignitaries and the organizing team of Association of Kriyashari, the very respected and senior faculties, Vedya Mahendra Singh Meena sir, who is the convener, Vedya Nandini Dhargalkar ma'am, she is the president of our association, Vedya Balakrishna Panwar sir, Vedya Nandakishore Dadi ji, Vedya C.R. Yadav ji, Vedya Dinesh Chandra Sharma ji. All these dignitaries are the vice presidents, Vedya Sushil Kumar Dubey sir, joint secretary, Vedya Deepa Kare madam, treasurer, and myself, Dr. Shilpa Hirme, as a secretary. So I welcome all the participants, students, and doctors for this session. Before starting the session, I would like to play a Dhanvantari Vandana. So once again, I welcome all the dignitaries. I think Dr. Swati Chobe madam also joined the session. So welcome, ma'am. And our today's topic is that physiological role of tridosha and its significance, clinical significance. Uh, अभी यहाँ पर मैं हमारे आज के जो फैकल्टी है डॉक्टर कादम्बरी मैडम, इनका एक शॉर्ट बायोडाटा आप सभी के लिए एक परिचय मैं यहाँ पे देना चाहूंगी. Madam has completed BMS in 2010 from the KLE itself, then MD from Ashta College and PG Diploma in Panchakarma from KLE University, and she is now also pursuing the PhD degree from KLE. She has published various research articles in Scopus and PubMed, and she has completed research projects, and she is the principal investigator in the various different kind of topics. She has totally published 13 publications and awards for best paper presentation at Pragati International Conference at Kahir, Belgavi, and first prize at Faculty of Yoga competition at the eve of International Yoga Day at Kahir, paper and poster presentation in international conferences, and as a resource person for the 12 conferences and a guest speaker for the various sessions. She has also worked as an organizer for various workshops like Prakriti, webinar series, camps, and so on. So, Dr. Nandini Dhargakar madam is also present here. So, I welcome ma'am after a long you are here with us. So, thank you very much joining the session. And I also welcome Dr. Chobe madam. She is also a very respected personality in the field of kriyasharir. और फिर मैडम के सेशन के बाद हम चौबे मैडम को भी सुनेंगे। तो सभी का स्वागत करते हुए मैं डॉक्टर कादम्बरी मैडम से रिक्वेस्ट करती हूँ कि वो अपना सत्र स्टार्ट। यू कैन शेयर मैम।
मॅम स्लाइड इज विजिबल?
येस येस, जस्ट मॅक्झिमाइज जर केलं तर बरं।
हा हो, बघा मॅम।
हाँ ठीक है मैडम, यू कैन कंटिन्यू।
गुड मॉर्निंग वन एंड ऑल। Myself, Dr. Kadambari Sagre, Associate Professor, Department of Kriyasharir, KLE Shri BMK Ayurveda Mahavidyalaya, Shahpur, Belgavi. Respected Mahendra Sir, respected Nandini Ma'am, respected Swati Chobe Ma'am, respected Balkrishna Sir, respected Nand Kishore Sir, respected C.R. Yadav Sir, and respected Sushil Kumar Sir, respected Dinesh Sir, respected Shilpa Ma'am, respected Sushil Kumar Dubey Sir, and respected Deepa Kare Ma'am. So I'm very thankful for giving this opportunity to share my views on this platform of Association of Kriyasharir. So today's topic, today I'm sharing my views as a physiological role of Tridosha and its clinical significance. So these are the contents of my presentation. As we all know, the three humors or the Vata, Pitta, Kapha, these are the cause for the production and destruction of the body. The process of the development of human being from the fertilized ovum to the fully grown child, which takes place with the help of Apamahabhut in the form of Kapha, Agni in the form of Pitta, and Vayu in the form of Vata. So in fertilization, Vata which develops the fertilized ovum, Pitta which does the Dhatu Parinam, digestion and the assimilation of the food, and Kapha which has take role in imparting a form to the body and sustain it. As we all know, the Ayurveda has the concept like Loka Purusha Samyata. So in Ayurveda, whatever the present in the universe, the same things present in our human body. And nowadays, this concept has already came into the clinical practice in the form of Panchabhautik Chikitsa. As we all know, everyone is doing the Panchabhautik Chikitsa based on the Loka Purusha Samyata. So also the Visargadana Vikshepi, the Soma, or the Visarga as the compared as a Kapha, Surya compared as a Pitta, and the Anil, that is compared as the Vata dosha. So what is dosha? Dushanata dosha, that which is responsible for the vitiation, Sharira Dushanata dosha, that which vitiates the Sharira, and Dushyantiti dosha, so that which is vitiate. So dosha dhatu malamulam hi shariram according to Sushrut Sthana. So dosha, the factor which vitiate other substances after getting vitiated, dhatu which suppose the body, and mala which purify the body after getting excreted. Prakrutya arambhakatve sati swatantrena dushti kartutvam doshatvam. So that which form the temperament of an individual by birth and also having the independent power of the producing disease is called as a dosha. So there are three types of doshas: Sharirik doshas, Vata, Pitta, Kapha, and the Manasik doshas, Raja and Tama. So Sharir and Mana dosha relation, Vayu, Pitta, Kapha, Kshokta, Sharira dosha sangra, and Manasa, Punaradishto, Rajacha, Tamayevacha. So nowadays, as the Sharirik doshas are Vata, Pitta, Kapha, and the doshas Rajatam. So in this era, the persons are suffering more in the mental disorders, mental discomfort, especially the children's. So where we have to focus on the Manasik doshas also. These are the three doshas which are responsible for the sustain the body also, and when it goes in the pathological area, these three doshas are responsible to destroy the body or the form any type of disease. So Bhautik composition, Vayu plus Akash Mahabhuta, which is presence in Vata dosha, Teja Mahabhut in Pitta, Jala and Prithvi Mahabhut for the Kapha dosha. So relation between Triguna and Tridosha. So Vayu is predominantly Raja in nature, Pitta Sattvic in nature, and Kapha has the predominance of Tamoguna. Panchabhautik composition, Vayu is mainly responsible for the Vibhajan. So as the cell division is because of the Vayu Mahabhuta, cellular metabolism is because of the Teja Mahabhuta, and the Apa Mahabhuta especially related for the Kledayanti, that is fluid balance, Prithvi Mahabhuta, which does the Sahanan, means the keep all the cells together, and the Akash Mahabhuta, which does the Vivardhan. So the Akash Mahabhuta, which gives the space to grow. So this is the very beautiful concept nowadays already come in the clinical practice. By depending on these five Mahabhutas, we are comparing these five Mahabhutas in our body and we are treating the patients. Tridosha is considered as a Tristula. So as we all know, the pillars of the body is Tridosha. And if these three pillars are in the balanced state, then only we will maintain our physiological balancing of our body with the help of Tridosha. If there is any imbalance or the any imbalance state comes in the Tridosh, then the one of the pillar get disturbed, which may lead to any type of disease. So Rakta as we consider as a fourth dosh or not, this is one controversy, but Rakta is the seat of the Pitta, and though no independent capacity to the Rakta to vitiate unless associated with the Tridosha. And there is no predominance in the Prakriti. As we all know, the Vata, Pitta and Kapha has their predominancy in the Prakriti. So doshas, even if having the contrary properties, do not destroy one another. So the example is how the snake venom being most dangerous to other creatures, but it not harm the snake in which it is present. So Nirukti, Vagati Gandhanoi, Pitta, so same Tapasantape, which is the Agni Mahabhuta predominancy, and the Pitta, which is responsible to burn the ingested food, generate the heat, and also helps in the vision. Kapha Shlisha Alingane, which keeps or the embrace to keep together. Kena Jalena Falati Iti Kapha, again the Kapha in general, which represents a potential source of the strength and which register disease and decay. So the Vata importance. Yoga Vahi Paramvayuha Sanyogada Ubhaharta Kruta Daha Kruta Tejasa Yukta Shita Kruta Soma Sanshra. So as we all know, Vata is considered as the Yoga Vahi, means it gives the movement to other bodies, and the Kapha and Pitta, Mala, Dhatu all are dependent on the Vata. Unless and until Vata is not giving the movement to other things, they are immovable. So same according to the Vagbhata, Vibhutvata, Ashukaritvata, Balitvata, Anya Kopanat, Swatantrat, Bahurogatvat, Sarvahi Cheshta Vatena, Sapranaha, Praninam Smruta. So Vata is mainly responsible for movement of the living beings and also life of the living beings. Pittam Pangu, Kafam Pangu, Pango Mala Dhatavaha. So Pitta, Kapha Dosha, Mala and Dhatus. These are considered as a limb without the help of Vata. So Pitta and Agni, as according to Charaka, Pitta is Agni itself, and according to Shushruta, Pitta is located in the body in the form of Agni. Kapha Prakrutasto Balam Sheshma. So Kapha in Prakruta Avastha. So whenever the Kapha dosh is in a normal state, it is considered as the Bala or the ojas of our body. And when it goes in the Vikruta Avastha or the vitiated state, then only it is responsible for the formation of any one type of disease. So Vata is considered as the overall controlling factor of our body. Pitta, which is responsible for the metabolism, production of the heat, and the others like catabolism and the anabolism reactions is possible with the help of Pitta dosha. Kapha, which gives the protection, strength, support, and the sustain to the body. So sarva sharira charastu vata pitta shleshmano hi sarva asmin sharire kupitaha shubha ashubhani kurvanti. So whenever these three doshas are in the normal state, these are like a shubha to our body. Means they are balanced state, gives the good benefits to our body, and when it goes in the akupita avastha, means it becomes a ashub, or ashub in the form of it is responsible for the formation of any one type of disease. So arogya definition also, rogastu dosha vaishamam, dosha samyam arogata. Vikaro dhatu vaishamam, samyam prakriti ruchate, sukha saudnyam, arogyam, vikaro dukhamemacha. So whenever these three doshas are in the balanced state, these are responsible for the sukha. And when it goes in the imbalanced state, these are responsible for the dukha. General sites for the doshas, te vapinoapi. So vata usually stays below the umbilicus, pitta in between the heart and umbilicus, and kapha above the hruday. So these are the sites for our doshas. So vata pitta shleshmanam punah sarva sharira charanam sarva srotyansa punah. So it moves all over the body with the help of srotasas, which serving as their passage. So according to Vaya, Prakriti, digestion, host, how the doshas will be. So as per the age, in the old age, usually the Vata becomes predominant. In the middle age or the youth, Yogvan Avastha, the Pitta is a predominancy, and Kapha is predominant at the childhood age. According to the digestion, at the end of the digestion period, usually Vata will be there. During, in between the digestion, Pitta dosha is predominant, and immediately after the food, the Kapha is predominant. As per the Koshta, the Krura Koshta is because of the Vata dominancy, Mrudu Koshta is because of the Pitta dominancy, and the Madhyam Koshta is because of the Kapha dominancy. In Prakriti, the usually only Vata Pradhana Prakriti person is considered as the Hina Prakriti. Madhyam Prakriti, whenever there is the person is the Pitta Pradhana Prakriti, and the Uttam Prakriti is a Kapha Pradhana Prakriti. Agni, so Vishama Agni is because of the Vata dominancy, Tikshna Agni is because of the Pitta dominancy, and the Mandagni is because of the Kapha dominancy. So by seeing these things, we have to take the doshas at the clinical level. So how? So if we go with the Swastha Panchakarma, or the treatment to balance the life, or to prevent the diseases, as per this criteria, if we plan the panchakarma treatment as per the age, or as per the digestion, or as per the koshta, if the person is suffering with the krura koshta, so automatically the vata is the predominance. So here we have to apply the samanya vishesha chikitsa siddhant, where we have to go with the vishesha chikitsa to come out with the vata problems. For example, the krura koshta persons usually goes with the bloating of the abdomen, gases distension, and always the on and off constipation problems having with the patient. So in that patients, we have to go with the sneha chikitsa, the to come out vata ko kam karne ke liye hame wahan pe the opposite gunas of the vata. So ruksha, laghu, chala, these gunas ko kam karne ka ahar and vihar we have to prescribe to the patients. Same with the prakriti. As we all know, the prakriti has a most clinical significance, but no one is giving a clinically importance to the prakriti. We are just assessing the prakriti. We are taking the prakriti either vata pradhana, pitta pradhana, kapha prakriti, but we are not saying the clinical significance of the prakriti. So nowadays, the one study, my PhD study is going on the prakriti, where we have given the most importance to the prakriti. So we are doing the dosha pratyanaka chikitsa according to the prakriti. So my study is, we are taking the diagnosed refractive error cases. So why we selected the refractive errors according to prakriti? Why? Because the refractive error is not has the systemic element composition. As we all know, the prakriti, where we have to take only healthy persons. Yes, whenever we take the diseased person, it goes in the vikruta avastha. So we decided to take the refractive errors which have minimal changes of the doshas, and we can assess the prakriti of that patients. So we have taken the refractive errors, and where the refractive errors comes because of the anatomical change than the any pathological change. So diagnosed refractive error cases, then we are assessing the prakriti of that patients After assessment of the Prakriti, we are giving the Dosha Pratyaneka Chikitsa to that patient. So Dosha Pratyaneka Chikitsa means if the person is with the Vata Pradhana Prakriti, and then we are using the simple Erenda Mula Churna capsules. For the Pitta Pradhana Prakriti, we are using the Yashti Muda Churna capsules. And for the Kapha Pradhana Prakriti, we are using the Pippali Mula Churna capsules. So for the 60 days, we are giving the medicine to that patients to just balance their doshas. We are not changing any physiology here. We are just balancing their Prakriti doshas to come to the normal level. And after 60 days, again, we are checking their refractive errors. So there are any changes with the refractive errors. So after 60 days, we found that there are so many changes happen in their general assessment than the refractive errors. Only some patients I found that refractive errors get decreased up to 0.5 or less, but general assessment, we have a 10 general assessment criteria where the person appetite, whether appetite has increased, where constipation has get relieved, where the patient is feeling enthusiastic after taking this. So there are 10 criteria. So whenever we are assessing these 10 criteria after their 60 days, we got good result in the Dosha Pratyanika Chikitsa according to their Prakriti. So this concept, why I chose means we have to give the clinical significance to our Prakriti. So dosha relation with the rasa, as we all know, so kopak rasa, vata dosh increases with the help of katu tikta kashay, and the same manner if we want to stabilize the vata dosha, we have to give the opposite rasa like madhura amla lavana. Same with the pitta, katu amla lavan increases our pitta dosha. To stabilize that, we have to choose kashay tiktan madhur rasa. Kapha, Madhura Amla Lavan increases Kapha dosha. So to stabilize Kapha, we have to use Tikta, Katu and Kashaya Rasa. Prakriti and Tridosh, as already I explained how the clinical significance we have to give to the Prakriti in the form of Tridosha. So from the fertilization itself, the Prakriti is determined by the help of doshas, which is located in the Shukra and Artha. And after that, the Prakrut dosha and the Vaikrut dosha, combination of the Prakriti, that is the genotype and phenotype. And if we are planning for the Dosha Pratyanika Chikitsa, means we does the more preventions than the cure. Dosha in relation with the Rutu, as we know, the doshas according to the Rutu, which is the Rutu Kriyakal. In Grishma, Vata takes the Chayavastha. In Varsha Rutu, it takes the Prakopavastha. And in Sharad Rutu, again it goes to the Prashamavastha. So if we plan the Swastha Panchakarma according to the Rutu Kriyakal, then so many diseases we prevent with the help of doshas. As we all know, Varsha Rutu, where the Vata is always in the Prakopavastha. And if we plan the Basti Chikitsa according to their Prakriti, so it will get very helpful to the patients. Same with the Pitta Prakriti persons, where the Parsha Rutu, in that the Pitta get Chayavastha. In Sharad Rutu, Pitta is always in the Prakopavastha. And if the person is found with the Pitta Pradhana Prakriti, and again we are planning the Virechan in the Sharad Rutu, then the beautiful results comes in the patients according to their Dosha Pratyarika Chikitsa. Same with the Kapha Pradhana Doshas, where the Shishir, the Kapha takes the Sanchaya Avastha. In Vasant Rutu, always it goes in the Prakop Avastha. And if we plan the Vamana Chikitsa in the Vasant Rutu, then the beautiful results comes to the patients. So dosha and chikitsa. So as the physiological role of the doshas are the very, very important, the same we have to give importance to the chikitsa according to their doshas. So Sharirajana doshanam kramena param aushadam basti vireka vamanam tata tailam grutam madu. So as Swastha Panchakarma I explained, where the Vata dosha has control with the help of Basti Chikitsa, Pitta with the Virechan, Kapha with the Vaman. The same manner we have to prescribe patient the Shamana Chikitsa. So Vata Pradhana Prakriti person always has take the help of Taila. So application of the oil, the Abhyanga, he has to go to elevate their Vata dosha. For the Pitta dosha, in daily ahar, he has to take with the Grita, or the in daily basis 5 to 10 ml Grutapana, we have to advise to the patients to control his Pitta dosha. For the kapha dosha, we have to prescribe madhu, that is the honey, in daily basis to control his kapha dosha. As we all know, Ashray Ashray Bhava. So Vata has the Ashray Bhava with the Asti Dhatu, Pitta with the Sveda and Rakta, and Kapha with the Rasa, Mausa, Medas, Majja and Shukra. So according to this Ashray Ashray Bhava, also we can plan the treatments. Though, so to control the Vata, usually we have to take consideration of the Asti Dhatu, where we have to increase Asti Dhatu Sara Lakshanas to control the Vata dosha. Same with the Rakta Dhatu Sarata, excellence of the Rakta Dhatu, we have to increase with their daily routines, diet, and the lifestyles to control the Pitta dosha. Same with the Kapha dosha, Rasadhatu. So usually Rasadhatu Vriddhi is mainly responsible for the now the diseases like the Madhumeha, obesity, where the first there is a starts with the rasadhatu dushti, and then it does the dushti of the medadhatu, and where the kapha dosha visheshan also will be there. So here we have to apply the rasadhatu sarata lakshanas, or the excellence of the rasadhatu we have to increase by preventing this and increasing the daily routines, diet, and the lifestyle. So according to Charaka, as the dosha sthan already explained, the the Vata dosha usually comes under the Pakvashe region, and the Pitta dosha in the Amashe, and the Kapha dosha which stays in the chest region. So these are the Vishesh dosha sthanam. According to the Vagbhata, also Vagbhata has explained the dosha sthanam. So Pitta, Dabhiramashe, Svedolasika, Rudiram, Rasaha, कफ उरहकंठशिरा क्लोम पर्वानामाश्वरसः मेदो घ्राणं च जिह्वा च कफस्य सूत्रमरः. So सर्वधा सर्वभावानां सामान्य मृदिकारणं रास हेतु विशेष च प्रवृत्ति रूपेण. So samanya which causes or the increases the same gunas, and vishesh does the decrease of both. So if we educated the people about the Samanya Vishesh Siddhant through the diet and lifestyle. So what their Prakriti, according to the Prakriti, if they are following their diet, lifestyle, then we are very near to prevent the diseases and cure the diseases only with the daily routine. So gunas, as we all know, according to Charaka, Ruksha, Shita, Lagu, Sukshma, Chala of the Vata dosha. Pitta, Sasneha, Tikshna, Ushna, Lagu, Vimsra. And Kapha, Snigdha, Shita, Gurumanda, Shlakshna. So based on the Samanya Vishesh Siddhant, if we prescribe the diet, lifestyle, and the routines to the patients by taking the consideration of the Vata, Pitta, and Kapha dominancy, so without medicine, it is very helpful to the patients to come out from the diseases also and prevent the upcoming diseases. So dosha types: prana, udana, vyana, samana, apana, pitta, pachak, ranjak, sadhaka, alochak, brajak. So these are the, according to the types, if we are doing the treatment on the local basis, so that also gives the good result to balance the local doshas. Aulambak kapha, kledak kapha, bodak kapha, tarpak kapha, sleshak kapha. So formation of kapha, as we all know, the kapha formation, which is the one of the Anyasya Bhukta Matrasya, that is the Pratham Avasthapak, where the kapha get formed. Then Pitta, which is formed in the second Avastha, that is the Amla Avasthapaka. And the Vata, which get formed at the Katu Avasthapaka. Normal functions of Vata Pitta kapha. So Utsaha, Shwasa, Nishwasa, Cheshta, Vega Pravartana. So enthusiasm, the activation of the body mind, respiration rate maintenance, initiation of the urges, maintenance of the dhatus. So these all proper functioning of the Vata dosha is possible whenever we will try to maintain our Vata dosha in the form of dosha pratyanika chikitsa. So these are the functions of the Vata dosha. Pitta normal functions: darshanam, paktirushmacha, kshutrusna dehama ardhamam. So here the darshana, So as we all know, according to our classic, Pitta is mainly responsible for the good vision. So nowadays, the children are also suffering with the vision problems, youngsters also suffering, and the oldest peoples also suffering with the vision problem. So if we try to take dosha pratyanika chikitsa concept according to Prakriti in the clinical importance in the refractive errors, so we can prevent the many cataract surgeries, many other complications which is related with the eye disorders with the help of dosha pratyanika chikitsa. So here the according to dosha, if the doshas are in the balanced state, for example, pitta dosha is in the balanced state, it helps for the good digestion, and if it goes in the vitiated state, it is gives the problems like the indigestion. Same with the vision or the loss of vision. So normality and abnormal body heat or the complexion. So there are so many skin disorders are because of the vitiated pitta dosha. To come dosha in the normal state, we have to maintain the diet, lifestyle, and the routines. So kapha normal functions. As kapha, we all know, it does the sandhi seshleshana, snehana, rupana, purana snehakruta. So prakruta kapha is responsible for the giving good quality of sansleshana. So also the, as we all know, the oldest peoples usually suffering with the knee joint pain, knee joint disorders. So this is again because of the where the shleshma kapha get decreases more and more. So here to come out this, we have to go with the Janubasti. So simple Janubasti treatments are the only oil applications can give the snehan to the shleshma kapha and which relieves from the pain to the joint pain. So clinical significance of the tridosha. Causes. So these are the causes for the prakop of the dosha. So which are the causes? So mainly the pradnya parada, asatmendra sanyoga, and the dhruti smriti, as we all know. So ayoga and ati yoga and the hina yoga dhruti smriti, these are the main reasons for the dosha vitiation. Sanyog of the sense organs, action, and the time, which are the beneficial for the maintenance of health. So same the dosha gati, according to the transformation, if the kshayavastha or the sthana or the vriddhi of the dosha are the responsible for the any type of disease. Same udva, adha, and tiryak gati, which is the responsible for the dosha vitiation. So dosha is considered as the pathogenic factor to form any type of diseases. So doshas get aggravated or the increase which manifests their sign and symptoms. When it goes in the decreased state, that also manifests their sign symptoms, and the both the conditions which are mainly responsible for the production of any type of disease. Vata vriddhi lakshanas, as we all know, kasha kashoshna kamitva, kampanaha shakrudgrahan, bala nidra indriya bhransha, pralapa brahmadinata. So here vata dosha, and also we have to take consideration of the relation of vata with the manasik dosha as the raja. So for to both we have to control with the help of dosha pratyanika chikitsa. Same with the pitta vriddhi lakshanas, pita vinmutra netratvaka, shuddha daha, alpa nidrata. So pitta, again we have to take consideration of the manasik dosha as a raja and sattva. So kapha, which is the vriddhi lakshanas like Shleshma Agnisadana, Praseka, Alasya, Gauravam. So these all things are possible because of the Kapha Vriddhi Lakshanas and the Tama Vriddhi Lakshanas. Vata Kshaya Lakshanas. So these are the Pitta Kshaya, where the again Shitam Prabhahani, that's Agni gate, decreases more and more, and Dravata of the Pitta gate increases, where the Agni get decreases, and the Mandagni, which is the responsible for the metabolism disorders. Kapha Kshaya Lakshanas. So these are the nanatmak vikaras which are possible either vriddhi or the kshaya of the three doshas. So vata has around 80 nanatmak vikaras, pitta has 40, and the kapha has 20 nanatmak vikaras. So dosha upakrama, which gives the more clinical significance. So vatasya upakramaha, sneha sveda samshodhanam mrudu. So Sneha, Sveda, Mrudu Sanchodhan is very important to control our Vata dosha. Same Abhyanga, Mardana, Sekha, the Basti Chikitsa, which is the Shodhana Chikitsa to control the Vata. So in case of the Ahara, Amla, Lavana, and the Madhur Ahar, which control our Vata dosha. And the Vishesh Chikitsa, where we have to start with the Taila Anuvasanam. So Anuvasana Basti with the help of Taila control our Vata dosha. So Pitta, Pitta se Sarpishapanam, Svadusheta, Virechanam. So here also, so Sarpipan means Grutapana is to control the Pitta dosha. Then Virechan as a Shodhan Sikitsha to control Pitta dosha. So in Bhojan, Madhura, Tikta Kashai Gunayukta Ahara, which control our Pitta dosha. Kapha dosha, where the Shodhana Chikitsa as the Tikshna Vamana, and we can also take as a Virechan to control our Kapha dosha. Then Bhojana, we have to go with the Katu Tikta Kashaya Ahara, which control our Kapha dosha. So Vishesh Chikitsa as the Vamana, Yusha Shudra, and Dhumapana to control Kapha dosha. So whenever we are comparing with the modern parameters, the definition of the word Vata is explains that the capability of conducting both the motor and sensory functions, and which leads to the conclusion that the important seat of the Vata is the nervous system, and the Pitta, which is responsible for the digestion and the metabolism of our body, and the Paka Parinam. So conversion or transformation is possible because of the Pitta dosha. So Pitta and the Kapha dosha is the, which is again responsible for the cellular fluid balance, and the Ambu Karma, which is the electrolyte balance, is possible with the help of Kapha dosha. So role of doshas in the etiopathogenesis. So three doshas alone, which are the main root cause for the production of the diseases. Three doshas in the imbalanced state, which are capable of vitiating the various structure in our body, which leads to the functional disturbance. And this disturbance of the equilibrium are regarded as a positive factor rather than the disease itself. So vata tarute nasti, ruja na pakaha pita tarute, nasti kapata chapuya. So no pain without the participation of vata, no paka without the pitta, and no pus without the kapha. So the conclusion is the Tridosh theory is the fundamental theory of Ayurveda. Samadosha Sabhagnicha Samadhatu Malakriya Prasanna Atmendriya Manaha Swastitya Vidya. So the primary position for the Tridosh indicates their importance as the maintenance of the health. Yes, so the maintenance of health is possible with the help of balanced state of dosha, agni, dhatu, and mala, and which again gives the prasanna atma, prasanna indriya, prasanna mata, and then only that person is considered as the swastha or the healthy person. So the physiological role is very important to identify the physiological role of doshas and how implicate in the form of clinical significance. So these are the references. Thank you.
Thank you, ma'am. Thank you for the wonderful insight on the Tridosha. And I'm now requesting all the participants, if there are any questions, you can ask directly or you can post in the chat box. Thank you, Dr. Kadambari, for your wonderful lecture.
Thank you, ma'am.
So if any questions?
गुड मॉर्निंग मैम।
गुड मॉर्निंग सर।
मैम ये दोषों की अंशांश कल्पना जो चिकित्सा में करते हैं उसके रिगार्डिंग पूछना, कुछ एग्जांपल जैसे डेली प्रैक्टिस में अगर कुछ आप बताएं।
दोषा सर क्वेश्चन अंडरस्टैंड है। दोषांक का अंश मतलब सर समझ में नहीं आया।
दोषों की अंशांश कल्पना जैसे हम डेली प्रैक्टिस में उसको कैसे कोरिलेट कर सकते हैं और कैसे जो डेली ओपीडी जनरल प्रैक्टिस के जो पेशेंट
हाँ ओके सर। हाँ दोषांक। सो फॉर एग्जांपल सर व्हेनेवर द पेशेंट कम्स टू यू फर्स्ट वी विल आस्क देम द कंप्लेंट्स, सिम्टम्स पूछते हैं सर। सो सिम्टम्स के अकॉर्डिंग हमारा हमें एक आइडिया आ जाती है कि वात के कंप्लेंट्स है, पिता समहाउ सर ओनली वात और वात के कंप्लेंट्स नहीं रहते, sometimes vata and pitta both complaints are there. So before my idea is sir we have to take first idea of the prakriti of that patient. So as we all know, the Prakriti Sthapan is nothing but the Chikitsa. So once we got the idea about the Prakriti of that patient, then immediately we can understand the Vikruta Avastha of that patient. So which is very easy concept to understand. For example, the person is with the Vata Pradhana Prakriti, and second dosh, maybe it is a Pitta or the Kapha, sir. And if we are planning for the any treatment plan, so according to the Prakriti, if we plan, then it gives very good results in that patients. So in Vikruta Avastha, if the patient is complaining of the Pitta, but the Prakriti of that patient is a Vata. So we have to, in Dosha Pratyanika Chikitsa, we have to balance both the doshas, Vata also and Pitta also.
One more
Thank you,
question
ma'am.
is
Thank you,
there,
ma'am.
ma'am.
Yes, sir. Yes, ma'am.
Assessment charts of Tridosha. Can you please describe?
Uh, yes, ma'am. Actually, Dosha Vriddhi and Kshaya assessment chart we prepared and we validated with the help of 5 experts, ma'am. But still, we have to modify where I want to take objective parameters in the Dosha Vriddhi Kshaya. So that work is going in our institute. So now, whatever the chart is there, they are along with the only subjective parameters. We are asking the patients about the only the complaints, whether which dosh has the increased complaints and the decreased complaints. So these are the subjective parameters. But if we want to take objectivity in the dosha vriddhi, so some objective parameters we are trying to develop in the dosha vriddhi assessment. So this work is going on. Once the work is finished, we want to does the statistical analysis for the dosha vriddhi with the objective parameters, and then in our hospital we are planning to use that chart for the patient dosha vriddhi assessments.
Can you please share the subjective parameters and objective parameters? Doctor
Yes, ma'am.
is asking.
For example, ma'am, in Rasavriddhi, actually, subjective parameters, we are just seeing the in Rasavriddhi and the dry skin, or the person is lean, and other things. So here in objectivity, we have to go with the any technology base. So we are using the dermatoscope, ma'am, for the by seeing the objective parameters. So how much hydration is present in that person. So that dermatoscope also, and the next level we have to checking the electrolyte balance. So how much electrolyte balance is there in that patients. So this type of objective, we are just work started, ma'am. Still work has not completed. Just one study is going on, and in that study we have started this work. So कितने तक होता है उतना मैं मैम again I'll share after 3 to 4 months. Just we
You can
started.
share the PDF or Word file if you have, so that all get benefited.
Yeah,
You
ma'am.
can-
I'll share with you.
Yeah. Okay, thank you. Any more questions? Any more questions? अगर कुछ प्रश्न है, otherwise we will go for the expert opinion. So thank you very much, all the doctors, for your contribution and presence. Now I would like to request today's chairman of the session, Dr. Swati Chobe ma'am, who is a very senior faculty in the field of Ayurveda and kriyasharir. So welcome, Dr. Chobe ma'am, and please share your views regarding the topic. Dr. Chobe ma'am, are you there?
Hello, can you hear me now?
Yes, yes, yes.
Yes, ma'am. Yes, ma'am. Namaste, ma'am.
Namaste. Uh,
Hello, ma'am.
Ma'am, are you able to speak? We will just wait for ma'am.
Yes, ma'am.
Meanwhile, if any question.
Yes, I'm back. Due to some technical glitches, I was not able to connect. Now,
Okay.
can I hear?
Yes,
Can you
ma'am.
hear me?
Yes,
Yes.
ma'am. Yes, ma'am.
अच्छा. So, Dhargar, I would like to continue with the previous one. Dr. Dhargar Madam is the first person in kriyasharir subject to promote concept of prakrut dosha and vaikrut dosha in India.
Yes, ma'am.
Like
Yes. Yes.
She taught us what is prakrut dosha and vaikrut dosha. She showed us the authentic references, and still I read her books.
Yes.
So, Dharkar Ma'am is the one who promoted this concept prakrut vaikrut dosha.
Yes,
So
ma'am.
Dharkar Madam, we will be grateful for your insights you
Yes, ma'am.
provided us.
Yes, ma'am.
And I wish you should throw light on many hidden references for the future generations.
Yes, ma'am.
So thank you, Dharkar, for your insights on Tridosha. And one more thing, I must congratulate Kadambari,
Yes, ma'am.
because when you are being asked, you are being shunned in the any lecture or in any conference. That means your lecture is perfect.
Yes.
It is almost near to perfection. It's
Yes.
almost near to perfection. So I think I must congratulate you to give us each and every reference from our compendia.
Yes, ma'am.
But next time I hope you will go beyond compendia and you will tell us the hidden meanings of all these references. But it was fantastically, and many questions were asked.
Yes.
That means your lecture was effective. So thank you all. Thank you organizers for organizing this lecture. Thank you very much. And thank you, Dhargar.
Yes, ma'am. Really, we are very fortunate to have Dr. Dhargar Madam as a president, and she is always contributing to us, and she is promoting Ayurveda as well, the kriyasharir. So, with the blessings of Dhargar Madam, we are here with this association of kriyasharir. So, thank you very much, and I request all of you to join the association. Association ये केवल हम सभी के साथ रहने के लिए है। आप सभी का स्वागत है। आप सभी एज अ स्पीकर जुड़ सकते हैं, और जो भी आपकी कुछ उपलब्धियां है क्रियाशारीर से रिलेटेड, यू कैन शेयर विद द ग्रुप और पर्सनली वी विल पोस्ट ऑन द वेबसाइट ऑफ क्रियाशारीर. So thank you very much, Dr. Kadambari,
Thank you,
and
ma'am.
all the participants, and thank you very much. And so we are ending the session today. Thank you all.
Yes, thank you very much, ma'am. Thank you, Sati ma'am, and all the participants. Thank you very much.
Okay, thank you.